First of all, I would like to ask for your permission to use this video for educational purposes. Do I have your permission?
Yes, you do.
Excellent. Now, tell me, you had back pain and other symptoms going for years back.
Well, back to 84.
84. And can you describe me your symptoms before the surgery?
Well, it was so bad that, I felt like you could just cut the bottom part of my body off and then I'd be fine.
1 to 10, how bad was your pain?
About a 35.
Okay, yeah. So it was really bad, and worst pain you had in your life. It went for years, for decades.
Right.
And people, and doctors. I'm sure you have contact to doctors. What did they tell you? Did anybody tell you about
Well, everybody
surgeries?
had told me there was nothing they could do with my back to begin with.
Yeah, what about surgeries? Did you ever talk about surgeries to other patients?
They said there was just totally nothing they could do.
Okay, and obviously, the open surgery is more invasive, and the results are sometimes limited. But what did your doctor, your own family doctor, tell you about the surgery?
Family doctor is a doctor that does not believe in back surgeries.
Okay, so.
But when I went in for my checkup,
And the surgery was
here,
1 month ago, correct?
Yeah.
Now, first of all, tell me, how are you doing?
I'm doing great. I'm walking and I feel good and I have very little pain.
And tell me about your doctor after you visited your doctor. What did he tell you now?
Well, that was just about a week ago, and he walked in. The first thing he said, "What the hell are you doing?" And I says, "Well, what do you mean?" He says, "You look so super." He says, "Your blood pressure's down, your sugar's down, you're walking."
Yeah, it sounds almost trivial, but we know that the pain is a stress reaction, meaning that stress reaction can mess up the rest of your body, and obviously if the pain is better controlled.
Well, then he asked me about my neck pain because I was having a lot of neck pain too. And I said, well, I can turn my head up and down.
And then that is another very good point you're pointing to, that when people have a spine problem in one area, the other area of the spine are being neglected, and people have compensatory posture problem that can cause as well problem in other area of the spine. And sometimes when we fix one area, the other areas react to that as well. Now, overall, how bad is your pain these days? Just 1 month after the surgery.
Today, or do I have to surgery?
Generally, these days, today, for example.
Until they gave me my CAT scan today, I was pretty well pain-free.
Okay.
But laying on my back, and it kicked in, but it's basically faded and gone now.
Okay, well, so, and having some pain in the post-operative stage is nothing unusual. But obviously, we will talk about your limitation and in more detail.
Oh, I'm way down on my pain medication. I was on 3 different pain pills, and I'm down to 1. And that was prescribed for 4 times a day, and I'm down 3 times a day on that.
Now, we discussed that in many cases, for an open surgery, you would not be a good candidate because the damage the surgery causes itself is too significant and practically the benefit of the surgery is minimal. In your case, we did the OLLIF, the minimal invasive procedure. Now, how would you rate the success of the surgery so far?
Oh, it's great.
Thank you very much.
It's absolutely great.
Thank you very much. I appreciate it.